Welcome everyone to the ASHP Foundation Summer Networking Event, the first annual summer event. So I'm really glad that you all came out today. This event's geared toward resident research in all of its facets. So we thought it'd be worthwhile to start with an interview with past residents and do some discussion. So today we're going to be talking with Sophia, and we're going to be talking with Carrie, and they're going to do some of their own introductions in just a second. And we're going to be asking them about what they've learned as a resident researcher. So as those slides were scrolling through before, what I really hope that you see is that there's something there for everyone across the continuum of your career. There's things for people just starting out like you, doing your first residency projects. There's people that there's resources, there's other things for people that are doing drug use evaluations, people that are doing smaller scale research within their health systems, and for people who decided to make research the overarching part of their career. So keep in touch with ASHP as you go through and see what kind of things they have going on. So why don't we start with Sophia? Why don't you tell us a little about yourself, where you did your residency training and where you are now?
Sure. Hello, everyone, and thank you for having me. My name is Sophia Nijat. I am originally from the Boston area. I went to school at Northeastern University in Boston. I completed my PGY1 pharmacy practice residency with Northeastern in collaboration with the community health centers. And then I completed a PGY2 at Rhode Island Hospital with the Lifespan Health System, and I focused on ambulatory care. Ever since then, I stayed on with Lifespan, and I currently work as an ambulatory care pharmacist, focusing on sort of population health with our accountable care organization, and I focus on our quality measures.
Nice. So Carrie, why don't you join our conversation?
Sounds great. Hello, everyone. Thank you so much for having me. My name is Carrie Tilton. I actually grew up in New Hampshire, so close to Boston, and went to undergrad and pharmacy school at Wingate University outside of Charlotte, North Carolina. I did my first year of pharmacy residency at Novant Health Forsyth Medical Center in Winston-Salem, North Carolina, and then came down to Atlanta, Georgia at Emory for my PGY2 in internal medicine. I currently practice as an internal medicine specialist at Emory, working closely with hospitalists and teaching teams and precepting residents, as well as serving as the PGY2 internal medicine coordinator.
So among all the different components of residency training, the ASHP research requirement is unique in many different ways. So what did you learn about yourself? What did you learn about pharmacists conducting research that you didn't know before? And why don't we start with Carrie, since you're still on screen?
Definitely. I think as a resident, I learned a lot from my preceptors and mentors, and that was really helpful. I think one of the most helpful takeaways is that in research, there are often obstacles, and those definitely come up, but how you navigate them and manage them is really important to see the project through, and really highlighting the emphasis of what pharmacists can do and the value they can bring to the healthcare system, I think are great research opportunities.
Nice. So Sophia, do you want to expand on that, or were some of your experiences different?
Sure. What I found that helped me be more successful with my research was to make sure that it's an area that you're passionate about. I personally worked on a project looking at hepatitis C clinics, and as I continued through my research, I found that there was a lot of advocacy that needed to be done in that area. And there were a lot of sort of moving parts and changes in regulation within the state of Rhode Island with regards to Hep C management. And I found myself very passionate, which allowed me, I think, to just really go through with the project and, stay excited about it.
Nice. So Sophia, since you're there on screen, why don't you tell us a little about your project's main objective, some of your main findings, who funded the project, and where it ended up getting disseminated, being presented or published?
Sure. So I looked at the effectiveness of pharmacy delivery care models with regards to hepatitis C clinics. So the main objective was to determine whether a clinic with greater pharmacist involvement, or what we call the pharmacist managed Hep C clinic, had whether it impacted treatment and whether it had greater success as compared to our separate hepatitis C clinic that had less pharmacist involvement. And the project was funded by the ASHP Foundation Pharmacy, the Pharmacy Resident Grant Foundation, the research grant for the residents. Sorry, a lot of words there. So we presented our poster at Vizient, as well as the ASHP summer meeting. And then we were fortunate to have our publication or a manuscript published in the AJHP journal. And then we were fortunate enough to actually use our data set to come up with a separate publication, which we published in the Rhode Island Journal of Medicine.
Nice. So Carrie, tell us about your project.
Yeah, definitely. So as a PGY1 resident, I worked with my preceptor to develop a C. diff risk prediction model at Novant Health. And as a PGY2, we actually worked to validate that same risk prediction model for healthcare facility onset C. diff. We wanted to first validate the previous model to see if it was applicable at other institutions, and then also develop a model of our own specific to Emory based on some differences in the risk factors that we found. For the risk prediction model at Emory, we found that patients who were hospitalized within the past 90 days or had malignancy, both hematologic and solid organ tumor malignancy, were at increased risk of healthcare facility onset C. diff, in which pharmacists could play a very important role in preventing C. diff by identifying patients at admission. We were able to present this at ASHP mid-year, and then also we were fortunate to publish it in AJHP as well. And this project was funded by the ASHP Pharmacy Resident Practice-Based Research Grant also.
Nice. So Carrie, that was a really good 1-minute overview, but it took a long time to be able to get to that point. And you had to start somewhere. And that's where the residents that are on this call now and the preceptors that are going to be helping to mentor them are at that initial stage. So walk us through your initial stages. How did the idea come up? And then where did you get from the idea stage to where you were able to start your project?
Yeah, definitely. Great question. So as a PGY2, I started residency, and my program director and I sat down to talk about research ideas, and she was very impressed with my PGY1 research project. I was able to work with an incredible mentor on that project, and in discussing that, we determined it would be a good idea to consider applying a similar approach at Emory. And so we were able to assemble a research team from that. And my preceptor from PGY1, despite being at an outside institution, was actually able to serve as a consultant to the project. He was definitely an expert in the field and had previously published risk prediction models looking at similar scenarios, and so he was able and willing to be involved in the project. So we were able to identify a research team, which included a ID physician, which is very helpful to have on board, as well as preceptors, my RPD, and the previous preceptor from my PGY1 program. We also had a statistician and a data analyst on board as well, which were very helpful to the project. And from that, we really modeled my PGY2 project after the PGY1 project, which was really helpful to have that as a baseline.
Nice. So, you actually can start a research path with some of the initial projects that you're doing if, there's a longer term research goal that you can continue to walk towards. So that's interesting. Sophia, what about your initial journey?
Sure. Well, it can certainly be challenging to complete a research project from A to Z in a 1-year time span. And I learned from my PGY1 experience not to bite off more than I could chew. So off the bat, when I started my PGY2 residency, I reached out to my different preceptors just to see what projects they were working on. And if they weren't working on any existing projects, what projects they, wish they could work on if they had the bandwidth. So after that, I gathered some different responses. And I then looked to see what was I most interested in. And I knew I always had an interest in gastroenterology. And so that's where I ended up starting my project with hepatitis C. And I had a great research mentor as well who helped me through, the statistics, helped run our stats, and was a great support. So that was very important.
Nice, nice. So one of the things that I heard during the conversation was that your PGY1 project you felt may have been a little bit too ambitious. You want to take 30 seconds and talk about that?
Sure. So one thing that I learned is doing prospective projects can be very difficult in a 1-year time frame. And so even though, for my PGY1 project, we looked at deprescribing proton pump inhibitors, and we were looking to, we didn't have an existing data set. It was more sort of recruiting patients and going through with that. But we realized we were still working on recruiting patients when we should have been writing the manuscript. And so, coming into my PGY2 year, I learned that if you have an existing data set or something where you can just tweak and do a retrospective project, it is more likely that you will be successful in completing that project within the 1-year time frame.
Good. Yeah. So we're going to be having Tyler and Kelsey come up in just a few minutes to talk about scoping your project, because I think that's one of the really important components that we're going to be talking about. But Sophia, once you started, did everything go smoothly for your PGY2 project, or were there any bumps in the road?
After having learned those lessons from my PGY1 year, I would say overall it was thankfully smooth, especially since I had such great research preceptor. I would say some of the bumps in the road were regarding our results. So we essentially found that there was no difference in treatment outcomes comparing the pharmacist managed clinic with our pharmacist assisted clinic, or the clinic with less pharmacist involvement. So it sort of went against what we were hoping to see and what we were hoping to publish. But we still, I think, found very meaningful conclusions. We unfortunately didn't have a clinic without any pharmacist involvement to compare to. But I think we still made the most with what we had.
Right. So Carrie, what about you?
Yeah, definitely some things came up. I think first and foremost was related to the IRB, just working with somebody from an outside institution, and my program director is also faculty at a college of pharmacy that it had to go through both IRBs. So that was definitely a added challenge, but we were able to work through it. We did encounter some hiccups with the data warehouse poll, just taking a little bit longer than expected, and having to go back afterwards to do a additional analysis, because we actually found that for patients who were on glycopeptides like vancomycin, there was an increased risk of C. diff for IV vancomycin, which we were surprised at. We anticipated this was due to the combination of antibiotics. So we did an additional analysis to go back and confirm what combinations that was, and we're able to find where that increased risk lied, whereas vancomycin alone did not have an increased risk. So definitely some added analysis in there and some IRB hiccups, but we were able to work through it and complete the project.
Cool. So we have 1 minute left in this segment. So in 30 seconds, what advice would you give new residents thinking about their project ideas now and how to end up with a viable final project? What do you think, Carrie?
Yeah, I would say definitely encourage the residents to own their project, work closely with their preceptor, but really take that initiative and work diligently to try to pursue publication. I think it's such a valuable experience to have as a resident to prepare you for when you are a clinician.
Nice. Sophia, bring us home.
Be realistic about what you can do within a 1-year time frame. Make sure to stay on task, because the year goes by so quick, and there's so many competing priorities. So whenever there's you have a research day or a block for, make sure to take advantage of that. And then also consider applying for the residency grant, because that was very helpful to me. I was able to get resources for our clinic. I was able to travel to 2 conferences related to GI. So I would encourage all residents to go for that and to apply.
Nice. Yeah. I mean, my final thought before we move on is that up to your career to this point, and then also throughout the rest of both of your careers, you're going to be consumers of the literature. You're going to be reading new studies. And I think having some firsthand knowledge of what it takes to be able to generate some of that knowledge, what it takes to be able to write it up and be able to submit it and disseminate it, and then also to take it and put it into practice when it's your own data, is a really worthwhile experience. So, for you, I'm glad that you both had, such a great overall experience. And I think for all the residents, I'm really, really hopeful that, you'll have a similarly gratifying and educational research experience. So thank you.